Hello, and welcome to my presentation on Xeroderma Pigmentosum. My name is Ariana Britton, and I will be talking to you on the basis of this nucleic acid base excision repair disorder. Um, just to start off, Xeroderma kind of looks like a sunburn in a way because people who have it aren't able to directly sit themselves in the sun. They have trouble going outside. They get really scaly, dry skin when they do try to go outside. So normally people who have this disorder tend to stay away from the outside. And if they do go outside, they normally have to wear a hat or they wear different long clothing items or different things that are needed to protect them from the exact sunlight. It looks a bit like eczema if you're just starting out looking at it. And normally people are diagnosed when they are younger children, so they already know they have it. And so their parents are there to help them fulfill everything that they need to get through it. But a lot of people are diagnosed as adults and they don't have the same quite prognosis that you'll see in a second. So, in introduction, Xeroderma pigmentosum is a hereditary condition that is characterized by an increased sensitivity to sunlight and exposure. This leads to a very high risk of skin cancer and other medically related problems that deal with the dermatological aspect and skin of medicine. Patients with this are extremely sensitive to UV or ultraviolet radiation, not only from the sun, but other electronic medical devices as well, such as CT scans, MRIs, X-rays, etc. This condition mostly affects the eyes, arms, hands, legs, and any other area that's outside on the body where it is directly affected by the sun and exposed to the sun. Some patients with this also have problems with their nervous system and gastrointestinal system as well. And so a little bit about the epidemiology of this, since it is a genetic disorder and it's rare, it affects only approximately 1 in 1 million people in the United States and Europe. It has been seen to be more common in areas like the Middle East, North Africa, Japan, any areas where you see a lot of people are there and it's a lot of sunlight beaming down on them. It's very hot, dry climate. Communities aren't very good for people who are diagnosed with this. And like I said, this isn't a surprise due to the amount of sunlight each of these areas are exactly exposed to. It affects males and females the same. Doesn't have an age limit. Like I said, a lot of people are diagnosed when they are born, but they don't notice any signs and symptoms until they get older. So it depends on the person, and it also depends on what exactly type they have. There are many different types and different symptoms that go along with it that we'll discuss later. And so for epidemiology, it's not a worldwide pandemic. Not many people have it, but there are some that do have sensitivity to sunlight. And for the etiology, this is an autosomal recessive disorder. So there are mutations in genes that are involved in repairing damaged DNA, aka nucleotide excision repair. Patients have a defect in the gene polymerase N ETA. This gene is located on chromosome 9, base 34. It says that DNA can be damaged by the UV light rays from the sun and other technological devices. So, like I mentioned earlier, MRIs, CT scans, anyone who has a sensitivity to the sun will probably have a sensitivity to the UV rays that are used in order to take pictures of the inside of your body. Chemicals and other toxins as well, such as cigarette smoke and recreational drugs such as marijuana and cocaine, are also very likely to cause xeroderma and worsen it and just make a whole entire flare up. Normal cells are able to fix DNA damage, but xeroderma, as we have just now learned, it's unable to fix the DNA pairs. We know that DNA pairs have A, T, G, and C. This is normally what it takes to replicate DNA, and some of the replication problems happen because it's not allowed to fix itself. So before the DNA damage causes any problems, our cells are supposed to reproduce and help us and figure out what's wrong, what gene doesn't match with this gene, what base isn't correctly going together. And xeroderma patients do not have this. So it causes problems that normal human beings who don't have this disorder with genes to occur. And so just some types and classifications. There are 8 different types depending on the gene. like I said before, you have the XPA, XPB, that's the ERCC3 gene, XPC, XPD, which is the ERCC2 gene, XPE, DDB2, XPF, ERCC4, XPG, ERCC5, and of course, XPV or POLH 10. So many of these disorders, they're classified pretty much basically on the gene. So normal human beings, they have all of these genes together, but they're absolutely fine. There's nothing wrong with them. The nucleotides are able to replicate themselves and base repair excision happens normally. But in people with xeroderma pigmentosa, it doesn't happen that way. They have a defect on any one of these genes, and it can cause some of the same problems. They have almost the exact same signs and symptoms. It's just a certain gene isn't working correctly and it's unable to do so based on what's going on currently. So many different people have this disorder and have some of the same genes, but the genes are different as well, and they're able to continue moving forward just like normal human beings are, except these particular genes are what's stopping them from staying in the sunlight for too long. See from these individuals, you have sunburn, blistering, spider-like blood vessels under the skin, patches of discolored skin, scaling of skin, oozing raw skin surface, not being able to stand outside for a long time, just really dry, really irritated red skin. Some people do get freckles, other people do get moles and different skin lesions and ulcers. So those are also signs and symptoms. And also just very irritable gastrointestinal systems, very weak bones, shortened stature, neurological defects. All of these can happen with xeroderma pigmentosa, but the main things that scientists and doctors are worried about is the fact that it can cause skin cancer and the scaling and oozing of skin, because it's so important. Our skin is our biggest organ on our body, and it's so important for us to protect that. And so when you don't have that barrier of protection, you're more prone to, of course, getting diseases and disorders such as infections that could be deadly. So the biochemistry behind it, I've talked about it, but we're just going to get back into it again. The biochemistry, XP can be caused by a mutation in any of these 7 genes that I named before that are involved in nucleotide-based excision repair pathways for DNA. It is a defect in this and the specialized DNA polymerase N, or ETA. Normal DNA and cells are able to repair themselves based on the many different repair pathways, but again, patients with XR are unable to do so. Pathological features and genetic basis. Again, XP is an autosomal recessive disorder consisting of variants in the nucleotide excision repair pathway. It is genetically passed down through families. Normally, for autosomal recessive disorders, you don't see a pattern of the disease in every generation of the family, but you do see that a lot of people in the family have it. So if you have someone from the 1st generation, 3rd generation, maybe 7th or 8th, they're not all in a line as in autosomal dominant disorders, but you do see quite frequent of a DNA mismatch and chromosomal mismatch pair. And so that makes it autosomal recessive, because not everyone in the family in each generation has the disorder, but there are a couple of people who have it, and you've been able to pick up on it because of your genes and your genetics that go along with it. And just some lab features, doctors and scientists use Southern blotting, which is used to detect DNA disorders, PCR, and cell fusion techniques to officially diagnose XP, followed by assessment of DNA repair or gene sequencing. It's normally diagnosed as soon as someone shows signs of extreme sensitivity to sun, including blistering, scaling of skin, and indoor fluorescent lighting, and or going to the doctor and getting an x-ray and finding out you broke out really bad. Like I said before, normal patients are diagnosed at a young age, and so their parents actually notice that there's something going on with them or something is wrong with them before they do. Normally, they try to weed out eczema or any other skin disorders that are similar to it, and so they realize something is actually wrong with the patient or with the person when they go to the doctor's office and they're unable to get rid of all the scarring, the freckles, the scaling of the skin. It gets really bad. And so that's when parents normally do the testing. Doctors do gene testing, all of these different things just to weed things out. And normally they're able to diagnose it efficiently with these three specific tests that I just named. Some differential diagnoses. I know I mentioned eczema before in the last slide, but you have your trichothionyl dystrophy, cerebral ocular facial skeletal syndrome, UV light sensitive syndrome, Rothroyd Thomas syndrome, basal cell nervous system syndrome, lupus, as well as nucleotide excision repair disorder. So a lot of these disorders are very similar, especially with eczema and lupus. You get the rashes on your face, on your arms. So a lot of these disorders are very similar, and that's why doctors, dermatologists in specific, take their jobs very seriously, because they want to make sure that it is eczema. So they'll usually biopsy the skin, any part of the skin that's scaling, just to make sure they have the right diagnoses, because if not, the chances of the person surviving are weak, and it's very deadly to begin with. So those are some of the diagnoses that doctors like to weed out before actually diagnosing with xeroderma pigmentosum. And so just the management and treatment for the disorder, there's currently no treatment, sadly. So the main treatment focuses on managing the symptoms of this disorder that are present and preventing future problems from developing, any cancers or suspicious lesions that may be removed by practitioners, dermatologists, to be tested and cared for efficiently. Lifestyle changes may be recommended as well, like decreased bathing, using cooler water instead of hot water, oat baths, soothing lotions and creams, specifically retinoid creams that they use for eczema, such as triamcinolone, drinking lots of water, decreasing exposure to sunlight, wearing your sunscreen daily. They can't stress that one enough, and sunglasses. Also, hats and long sleeves, long pants, anything that keeps you away from the sunlight can help. And so for the complications of this order, you have poor coordination, developmental delay, short stature, hearing loss, skin carcinomas, which is better known as skin cancers, skeletal and muscle tightness, loss of elasticity and fibrillin in skin, and permanent sun damage. So again, for the prognosis of these patients, many people with XP actually die in an early age, which is the mid 20s to early 40s, because of skin cancers and other ulcers that pretty much continuously grow regardless of the amount of treatment that they get, and because they're not immune to the UV radiation light, it actually hurts them in the process. And if a person is diagnosed and helped early, they can actually have a better chance of survival and be able to not only help themselves, but help others around them understand their disorder and be able to catch it in time. And some further research has been going on for 40 years now, believe it or not. There's been a rough road for scientists because they're unaware. They know what happens, they know why it happens, and that it's a genetic disorder, but they're so unaware of why it gets so bad. And so they've done multiple tests and clinical trials. And the only thing that was common in all these trials was the idea that therapy and steroidal creams were their best options. The retinol creams worked well. Gene therapy was also introduced about 10 years ago, and it developed as an option for those who have really bad cases, for scientists to pinpoint the exact gene that's going wrong in hopes of fixing it. Earlier technology wasn't able to do this, but now that we have reformations and new science technology, they're able to do that as well. Patients are also able to undergo frequent eye examinations and skin examination every 3 months to increase the quality of their lives. And these are my references. As I said before, xeroderma pigmentosum is so important for especially medical students like myself to learn, because a lot of patients do come in with skin disorder, rashes, everything like that. And this just tells us and shows us that not everything is eczema, not everything is a blister, not everything is a ringworm. We should definitely test deeper, and we should allow ourselves to make sure that our patients are going to be okay, because as we saw with some of these patients, they have pretty much normal lives. They're just like normal people. They look like they're just getting sunburnt, or they have a really bad suntan, but in reality they're going through being in the sunlight for too long and not able to survive because of this, and they're going through so much. And so when they do get older and start getting diagnosed with skin cancers, it becomes really bad because they didn't have the technology back in the day to actually help these people out. And so for me, I will continue my research on Xeroderma pigmentosum when I do began my clinical work and my medical doctorate job, just because I know a lot of patients do go through this. And like I said, skin problems are, they're very important because our skin is our barrier. This is our protection from the outside world. And so without that, everything in the inside isn't helped either. So this is my presentation on Xeroderma pigmentosum. Thank you so much for listening. Have a great evening.